Sisters in Medicine's advice is strictly informative and is not meant to be used for sole medical purposes. Always check with your local pharmacist or doctor before consuming any medications. Sisters in Medicine is not affiliated with any organization, nor do we represent any company's views or viewpoints. Enjoy. Hello, and welcome to the
Sisters in Medicine.
Today on these Sisters in Medicine, we'll be talking about a very well-known medication. This medication can be prescribed and it can be used over the counter. And that medication is called
Ibuprofen.
So Advil and Motrin have the same active ingredient, ibuprofen. See, Advil and Motrin are the brand names. They're both made from different manufacturers, but they both contain the same ingredient, ibuprofen, which is the generic name for this medication.
Okay.
Now, ibuprofen, guys, we all know it, we all use it.
We all love it.
We all love it.
I like it.
And today, we're going to be talking about what it's used for, how it works, side effects, and just an overall overview of all the things you need to know about ibuprofen, or Motrin, or Advil. Now, with ibuprofen, it's normally used to treat inflammation diseases, such as those diseases that can cause inflammation in your body, like rheumatoid arthritis.
Yes, that's a great
It's used very commonly in rheumatoid arthritis and also in osteoarthritis. But in addition to those inflammation diseases, ibuprofen is most commonly used over the counter to treat pain. Pain and things like fever, dysmenorrhea that women like me normally experience during their periods, as well as
So basically, dysmenorrhea, you would say, is like the symptoms attributed to our menstrual cycle. So like cramping, pain associated.
They're very severe, yes.
So when you're having your menstrual cycle, there can be situations where in the beginning of your menstrual cycle, possibly the first 2 or 3 days, you get this cramping sensation that's very painful. And that pain can be treated with ibuprofen. So for the most part, if you're going to be getting ibuprofen over the counter, you would probably be picking it up at your community pharmacy to treat the pain associated with maybe your period or just pain associated with your overall body. You could be having like body aches from working out or just getting hurt. And usually ibuprofen would be your first choice to treat that pain.
So like muscle and body aches and pain that is associated with your period. So basically alleviates pain.
Headaches, muscle aches, all those
Great
aches.
pain reliever.
Yeah, it's a great pain reliever. And the fun thing about ibuprofen, is that you can take it without worrying about having any liver issues.
It's cleared differently than Tylenol, which, if you remember, we spoke about in our other episode. It's cleared through the liver. Tylenol, ibuprofen is actually cleared renally or through the kidneys.
Renally, like through the kidneys, you say?
Renal is just another word that
So then
refers
how
to
does it work?
Oh, I can let you know about that.
Thanks, Henry.
Ibuprofen actually belongs to a class of drugs known as NSAIDs. I'm sure you've heard people throw that word around, NSAIDs. What does an NSAID mean? Well, NSAID is actually an acronym that stands for non-steroidal anti-inflammatory drug. And essentially what that means, when something is an NSAID, it just means that it has anti-inflammatory effects, but it's not a steroid. Steroids also have anti-inflammatory effects, but we'll probably discuss that in another episode. We don't need to go into that. So just for right now, know that ibuprofen is a type of NSAID. And so in regards to how it works in the body to reduce pain and fever, if you remember when we spoke about Tylenol, they reduce that hormone called prostaglandins. It's funny because ibuprofen also works similarly, but it does this a little differently. Whereas they don't really know how Tylenol works, they actually know very well how ibuprofen works, and it reversibly inhibits cyclooxygenase 1 and 2 enzymes, COX-1 and 2 for short. That's what we like. We like to shorten everything in the pharmacy world. So when it inhibits these COX-1 and 2 enzymes, it reduces the production of these prostaglandins in your body, and thus it reduces pain and inflammation. It also works to reduce fever, but I usually recommend Tylenol for fever first line, but you can use ibuprofen as well.
So would you say that,
Yeah, go ahead.
would you say that prostaglandins are kind of like those receptors that when they're released, they cause pain?
So I can actually, let me just hit that real quick, because mechanism of action can get kind of complicated. Prostaglandins are released from the response of our brain knowing that there's pain. So when we hit our elbow or we scratch ourselves or cut ourselves, we get messages that get sent to the brain that we should feel pain so that we know how to react next. So what happens is that our brain releases these prostaglandins. They're not receptors, they're mediators.
Yeah.
They
They're like
bind to
hormones.
receptors, basically. So when they get released, they induce that pain sensation.
Yeah.
So it sounds like ibuprofen also decreases prostaglandins
The
just like
amount of
Tylenol,
prostaglandins, yeah, there's just
but by acting on
it
the
does it in a
receptor that
different
it
way.
would bind to.
It inhibits those COX-1 and 2 enzymes to decrease prostaglandins, where they're not really sure how Tylenol decreased prostaglandins, they just know it did it. But ibuprofen inhibits the COX-1 and 2. Remember that if you want to go into pharmacy school. Inhibition of COX-1 and 2.
It stops COX-1 and 2.
Yeah, it stops. It reversibly inhibits, so it's it can be reversed back. It's not like irreversible where you never get COX-1 and 2 again, but it reversibly inhibits their action. You don't get those prostaglandins. You don't really feel as much pain.
Oh, nice.
Love it. That's simple enough. Okay.
Thanks for explaining that.
So ultimately and truly, I think I personally prefer ibuprofen to Tylenol.
I think
Me as well.
In managing my pain. But everybody's body is different and everybody breaks their medicines down differently. Now, why do I prefer it better? Because I feel like I can take the over-the-counter dose of ibuprofen over Tylenol and it alleviates my pain better. So what's the dose I take? So, if you're using ibuprofen for over-the-counter usage to alleviate pain, the appropriate dose that you can take is 200 milligrams. There are 200 milligram tablets ibuprofen, or the gel caps. Oh my gosh, I love the gel cap minis.
I think the gel cap.
Sorry.
Now the 200 milligrams, that's over the counter.
That's over the counter. But it comes as a tablet or a gel cap. Like I said, I love the gel cap. Hits the bloodstream so quickly. Okay, so the 200 milligram gel cap or tablet can be taken 1 to 2, so 200 to 400 milligrams every 6 to 8 hours as needed. It's important that you take ibuprofen with food. It's important that you take it with food because oftentimes ibuprofen can be a little bit tough on the stomach. And if you have food in there to kind of coat it, you know, it won't get absorbed so readily and so quickly into the bloodstream and lead to its toxic effects that it can have, which Amanda will definitely go into. But so the dosing is basically 200 to 400 milligrams every 6 to 8 hours as needed. If you don't need it, you don't have to take it. However, with ibuprofen, you do not want to exceed over 3,200 milligrams a day. 3,200 milligrams a day. You should not be taking more than that in a 24-hour period. So as long as you know how to take it safely, more than likely, you can use it to manage your pain in fever, you know, if Tylenol's not working. But just make sure that if you're not sure, once again, go up to your local pharmacist and voice your questions. Oftentimes, you know, ibuprofen, just like Tylenol, may be in another product, and you do want to make sure that you're not getting a double dose in any way, shape, or form. And like Emery did mention, ibuprofen, you know, it works through the kidneys. That's how it gets broken down. So you have to be careful if you're taking other medications and other drugs that might also be broken down through the kidneys.
Right.
But I can't lie to you, those gel caps are
I think they're
Yeah, I like the
for
gel
cramps.
caps.
They do
great.
wonders.
Headaches,
Oh,
anything.
they do wonders.
I don't know
Really
if
do.
it really does, but I think it does. So.
Yeah.
I love it.
I love it.
I believe the gel caps do actually get to your bloodstream quicker.
They do.
You think because of the way they're formulated?
It's the way
Yeah.
they're
It dissolves
formulated.
faster?
Mhm.
Okay.
So that makes sense if you think about the chemistry behind it. Like you have a gel cap, and you know when you take it, your body can probably disintegrate it quicker than it can a tablet. We can go into breakdown in a minute.
Pharmacokinetic properties.
Pharmacokinetics all day, but we'll touch on that another day.
So let me go into some of the side effects. Sorry to rain on you guys' parade.
Oh, never
How
that.
great.
Not really.
How
Great. You're not
I
rating. We need to know.
everything
We need
you
to
have
know
to
the facts.
say.
Yeah.
So some side effects include nausea, vomiting, bloating, dizziness, and mild itching. And so you had touched upon how it's metabolized through the kidneys.
Yes.
So prolonged use can cause damage to the kidneys. So again, you want to make sure you're using it correctly. And again, you had touched upon how you need to eat before you take it because taking ibuprofen without having food to absorb it in your stomach can cause peptic ulcers, which are also called stomach ulcers.
Okay.
So you just need to be careful when you take ibuprofen, but it is a wonderful drug for pain.
Yeah, it really
Yes,
is.
we all agree.
You all know.
Yeah.
And just to know, and kind of going off what Amanda just said, you should always note taking your medication carefully.
Right.
Because honestly, compliance, which is staying adherent, which is the same as just taking it at the right dosage and at the right time, is the leading key to getting rid of any pain or any association you may be taking the medication for. So you have to take it properly and you have to take it at the right time in order to get that effect so that you don't end up abusing the drug. because
and it's also the leading key to reducing the toxicity associated with taking that medicine.
exactly, exactly. So it's really important that you follow the guidelines on the bottle and the guidelines that we're talking about, because we're here to make sure that you take these medications appropriately and you actually gain the results that you're looking for without getting more sick.
So, questions, comments,
Yeah, and
concerns?
Leave them down below.
Hit the email. We're here for you.
Let us know what you want to hear. Thank you for listening.
Thanks,
SIM for the win.
guys.
Thanks,
SIM
guys.
for the win.
Sisters in medicine. Sisters in medicine. Sisters in medicine. Hey, hey. Sisters in medicine. Sisters in medicine. Hey. Thanks for watching.